Hello, my name is Dr. Steve Kregel. I work here at the St. Cloud Ear, Nose, and Throat Clinic, and I'm here to talk to you a little bit about the process of a surgery called a tympanoplasty. Now, tympanoplasty is a procedure done for a number of different reasons, and we'll cover a couple of those in the next minute or two. It is a surgery on the eardrum, and it usually involves the eardrum, possibly the ear bones, and any structures beneath the eardrum. Sometimes it's done for infection. Sometimes it's done because of a hole in the eardrum, perhaps a traumatic injury to the eardrum. Sometimes it's done for a condition called cholesteatoma, in which essentially a skin cyst forms underneath the eardrum and begins to cause damage to the ear bones or to other structures of the middle ear. So just a quick anatomy lesson. The outer ear is the portion that you can see plus the ear canal. The middle ear starts at the eardrum and ends a little bit farther in at the inner ear bone. And the inner ear bone itself is what contains the cochlea, the balance center, and the nerves that go into the brain. Tympanoplasty basically works on the eardrum and structures in the middle ear space. So, who might need this surgery? Someone who's had hearing damage from previous infections, someone who's had some sort of trauma that has caused damage to either the eardrum itself or to the ear bones, someone who has a cholesteatoma. Sometimes a patient will come in with an unexplained hearing loss that seems to be related to the eardrum or the ear bones, so-called conductive hearing loss. And for that reason, we sometimes do a tympanoplasty to examine the ear bones and see if a repair needs to be made to the ear bones. So, you've come in for your consultation, we've discussed the procedure, and now we are going to have you for surgery. The surgery typically lasts somewhere between 30 minutes and 90 minutes. Your surgeon will describe the typical length of time. The operation is generally done under a complete anesthetic. It can be done with sedation, and again, your surgeon will discuss that with you. The procedure itself takes place typically through the ear canal. Occasionally an incision behind the ear will be made, but most of the time the canal is the approach for the eardrum. An incision may be made right next to the eardrum itself, and a portion of the eardrum turned outwards, sort of like lifting up a tent flap and looking beneath the eardrum in that fashion. You can see all of the ear bones, you can see other structures that might be of importance, you can see if a cholesteatoma cyst has occurred, you can generally tell where the cyst is. So the eardrum is turned up so we can look under it. The work is done, whatever that might entail. Sometimes a little bit of cartilage from this portion here, cartilage from this portion here, or a little bit of other kinds of tissue called fascia, which is usually harvested just behind the ear. One of those bits of tissue may be needed to, say, patch a hole in the eardrum or protect a piece of an ear bone that has been damaged. So it's generally your own tissue that's used in the repair because that will take very well. So whatever the repair material, there's a period of time afterwards in which we need to not allow trauma or injury to that area. And we'll talk about the post-op concerns in a bit. Once the repair has been made to the eardrum, the ear bones, or the cholesteatoma cyst, then the eardrum is returned back to its normal position, usually protected with some kind of packing material of sort, usually a dissolvable type. And sometimes the ear canal is then filled up with a triple antibiotic ointment just to make sure that the incision doesn't get infected. Sometimes there's just a cotton ball in the ear canal. Sometimes there's a bandage that goes over the ear and around the head, sort of a band around the head to put pressure on the area. And in any case, those dressings are removed after a day or two. Typically, we ask folks not to fly or have a lot of altitude changes, like driving in the mountains, for a period of time. It can be a 2-week period, it could be up to 6 weeks, because some damage to the eardrum can occur as those pressure changes occur. Otherwise, most people can get back to work after a week or so. If they do very strenuous work, it might be a 2-week period prior to going back to work. Occasionally, dizziness can be a problem after an inner ear surgery, and so if that does occur, we have medications that we can give, and we will maybe hold you out from work for a little bit longer than that. So in short, a tympanoplasty is a surgery to the eardrum or the structures just beneath it to repair damage or to restore hearing or to remove a cyst, and typically involves a 1 to 1.5 hour procedure and a 2 to 3 day recovery with 2 weeks or so of limited activities.